So this is Zach, and he's a little guinea pig, and like some guinea pigs, he needs to get some oral medications every day. Giving oral medications is actually quite easy to do. Sometimes they really like the taste of it, and it's very similar to giving syringe feeding formula as well. So this method works both ways. So with a medication, you want to make sure that you have it drawn up and ready to go. And you want to ideally have them on an elevated surface with good footing. So something like this towel is great. And that way we're kind of on their level as well, not chasing them around. So once we have them on the table and our medication pulled up, you want to just gently kind of lift the head here. And then when you're lifting the head, you're looking for those cute little lips and going right under those lips. And Zach is a champ, and he loves his medications. So really easy. Sometimes you do want to go slow. Make sure that they eat it all, and that is it. This little guinea pig right here is in need of a sub-Q injection. So sometimes we send home antibiotics that need to be given underneath the skin. And so when we're doing that, we want to make sure, number one, that you guys feel comfortable, but also that it's safe for these little guys. When we're giving injections under the skin, you want to kind of pinch up on the skin right around the shoulder area, so kind of right here. So the skin area that you want to pinch up on is right here along the shoulders. And so we're just going to give a little pinch up on the skin here. When you do that, you're almost creating like a teepee of skin. And so you want to kind of, when you're giving the injection, you want to put the injection inside the teepee of skin. Sometimes when you're doing these types of injections, it's good to have distractions as well. So either a friend to help you, or as Zach is doing, eating some really good food here. So once you're ready, you have your medications drawn up in your syringe. You're going to take the needle off very carefully. And then you're going to pinch up in that shoulder area. So we're just going to give a pinch on the skin right here. And then we're going to inject right into our little teepee. So right in all the way, and you'll feel a little bit of a give once you're through the skin. The way that you make sure that you're in the skin or underneath the skin is by pulling back on your syringe so that you get negative pressure. So when I let go, there's no air. It goes right back to where it was. So now I know that I'm underneath the skin, and you can give the injection. So he did great, and we're just going to pull the needle out and gently recap it. Make sure that there's no leaking of that medication in the area that you gave it. If there is any leaking, you can take a little bit of a Kleenex or a paper towel and kind of wipe that down to make sure that none of the medication is on the fur where he might be able to lick it off or ingest it. Sometimes we need to give our little guys some sub-Q fluids or fluids under the skin. It is very, very similar to give something like a guinea pig fluids, just as you would a dog or cat. So this is something that can help keep them hydrated. It's something that we may request for certain disease processes, or if they're just not doing great at home. So fluids, you want to make sure that you get your fluids drawn up. And then we usually use a butterfly catheter. This just makes things a little bit easier. So if Zach decides to move here, that needle will stay in place. So we'll get that primed. I know, Zach, this is not for you, my friend. You want to get the needle primed. So the butterfly catheter, you want to go ahead and make sure that that's all the way to the tip until the fluid's coming out there. When giving injections, it's always nice to have somebody handling, just supporting the guinea pig. Any sort of distractors are always helpful if you can as well. So we're going to just pinch up on the skin here along the back area. So make sure that you've got a little kind of teepee of skin here along the shoulder area, and the needle's going to go right in that little teepee. So we'll just gently pinch up on the skin. Go into that teepee, which he did great. You'll feel a little bit of resistance when you do that. And then to make sure that you're where you need to be, pull back on your syringe. And I'm getting negative pressure here, which means that I am under the skin. We didn't go through and through, so there shouldn't be any leaking. When you administer the fluids, You want to give it, and you want to be able to see a little bubble start to form. So we're getting a nice little bubble here that's forming. You want to make sure that that bubble doesn't get too tight and that they're comfortable. Once you're done administering your fluids, gently pull the needle out and kind of pinch the skin at the base. And then that way your fluids are there, and just make sure that there's no leaking. If there is leaking, that's okay. Go ahead and take a little gauze and put a small pressure, or something like a Kleenex or small towel. But that's how you give sub-Q fluids. And again, usually in the shoulder region or along the back area. If there's a large amount of fluids, you can put it lower back here so that it can expand a little further.